Hello everyone, my name is Han Nguyen and today I'm going to present the case 15, Ms. Drucker. So this is a 76 years old female. She came in with chief complaint of sad mood, unintentional weight loss, insomnia, diminished interest, excessive worries about her finances, feeling of insecure with insecurity with others, and difficulties in concentration and word finding. She reported that she had reduced her social interaction, stopped going to her senior citizen center, out of her weekly card game because she could not concentrate or memorize her cards. She had lost 7 pounds in the past 2 months, and her sleep was interrupted by periods of insomnia with agonizing ruminations. It's the first time she had experienced any psychiatric symptoms. Her past medical history consists of hypertension, hyperlipidemia, and history of coronary artery disease with stent placement. She currently taking aspirin 81 milligram, atorvastatin, hydrochlorothiazide, and omestin. She also have history of 15 pack year smoking. In the review system, patient is positive for depressive, anxious mood, and sad affect. She is positive for preoccupied with finances, but could be temporarily reassured. Patient appear to be disheveled, drained of energy, and sluggish responsiveness. Her physical finding consists, especially the neurological exam, showed that she was able to recall 2 out of 4 objects in 3 minutes and recognize a third when given several choices. In 1 minute, patient could think of 14 items available in a supermarket. She failed to cluster items of similar kind. She had difficulty produce a list of vegetables alternating with items of clothing. She produced 12 correct responses and 4 errors. Mini mental state examination score was 24. Her Stroop test score was 22 correct responses over 1 minute. Block drawing exam showed unequal hours placing, but the hands are in the correct location. Her CT head revealed that a pronounced periventricular and subcortical white matter hyperintensities. Is a thought process coming to the diagnose her condition. Let's start first with the Stroop test. So with Stroop test, you want to see if patient has capability for selective attention. So under different stimulus, patient has to pick the right stimulus. This is how the Stroop test typically look like. Patient asked to tell the color, despite the words is different than the color. For example, you see the green can be the background color, but the words say purple. So the correct response would be green, not the purple, when you ask for the color of the words. Usually they detail the Stroop test into 3 cars. The patient reads 100 colors names, so just word reading. Now with car B, patient was to name 100 color, so it's color naming. And the car C, which is the one I just showed you, is incongruous colors words. Patient is to name 100 incongruous ink color in which color names are printed. So usually, of course, patient perform better with car A than car B, and car B better than car C. Remember, Ms. Barker, on her car C response, that's the one mostly physician based upon. She scored 22 correct responses over 1 minute. And remember that we have 100 items, so definitely she has some slow response going on. The mini mental state examination I displayed right here is how the exam looks like. There's some few questions regarding orientation with time, place, attention, calculation, recall, naming, repetition, and so on. The total score would be 30s. The patient score between 20 to 24 is show mild dementia, 13 to 20 show moderate dementia, and less than 12 show severe dementia. So With the patient, she scored 24, so she right off the edge for mild dementia. Any cognitive tests, patient usually being asked to perform tests, either remember and a few minutes later repeat the names of 3 common objects, or draw a face of a clock showing all 12 numbers in the right places and a time specified by the examiner. So any abnormality come from this test will warrant some cognitive declines in the patient. And with the patient that we have in this case, she be able to recall 2 out of 4 items. She be able to name 14 items in the supermarket. She failed to cluster items of similar kind. She also have a difficult time producing a list of vegetables, alternating with items of clothing. With her clock exam, she be able to place the hands in the right location. Her clock show unequal hours placing. Also, we have to distinguish between depression symptoms and dementia symptoms because they have some overlapping as well. Last but not least, patient CT findings show the white matter hyperintensities. White matter hyperintensity are the manifestation of small vessel disease. So over the long period of time, under certain conditions like hyperlipidemia, atherosclerosis, and other vascular disease, the brain deprived from the blood perfusion will slowly cause the process of incomplete infarction, and those small insults gradually accumulate. Um, those people with white matter hyperintensities tend to develop eventually cognitive impairment, dementia, cerebral vascular disease, or stroke. So with all that being said, it is very likely that patients have dementia in early stage and possibly due to vascular. So what is the plan and treatment? Vascular dementia cannot be cured, but there are ways to manage the symptom, or per se to slow down the progress of the symptoms. First, since the patient is a smoker, first off, encourage patient to stop smoking, manage better her hypertension and her high cholesterol to help with better blood perfusion to the brain. Also, patients are encouraged to exercise to preserve cardiovascular function and also to ease off nighttime restlessness, since patient also exhibit the symptom insomnia, so that would be beneficial for her. Even though patients have a hard time to participate in group games, she should be encouraged to continue engaging in social activities, such as continue to go to her senior seasons center, participate in her card game to promote better quality of life and increase interaction. It's better for the brain health. She also should be encouraged to simplify tasks for better following and focus. Regarding insomnia, patients should establish a nighttime ritual with care, calming and away from noise, limit caffeine intake, avoid heavy dinner, and discourage napping during the daytime. My patient might find light therapy to be helpful to manage the insomnia as well. Regarding medication, there's a wide variety of medication can have boost memory function. One of them is Aricept. My side effects such as nausea, vomiting, diarrhea are expected, and providers should discuss with the patient before start the dose. If patient offer the alternative medication, ginkgo can be very helpful for memory. Other studies have shown that pet therapy, such as visits from dogs, might improve patients' mood and behavior. Last but not least, providers should engage patient and family member to participate in care plan, decision making, and support groups. Since the disease is progress, patients should be planning for the future, just in case one day she cannot make her own decision anymore. And we reach toward reference for my presentation. Thank you so much for all of your attention.